And then Farmersville on it is on the other side of Cooper. Or on the other side of him.
Sounds like I hope it's on the other side.
So yeah, we'll play somewhere between. See what's in between us. I bet we'll play Winsboro. We're gonna play Winsboro or Emory. Anthony, we.
Okay, we should be on like page 3 of your PowerPoint. So we'll do this one first. Chapter 9, where it says pharmacology and endocrine system. So we'll talk about hormones today, and we'll add in just a little bit more than just hormones, but endocrine system. Okay, so it says the endocrine system consists of specialized cell clusters, glands, hormones, and then target tissues. Target tissues are the areas that it specifically affects. And sometimes it can be both. A target tissue can also be something that actually secretes a gland, like the adrenal gland, for example, is a target tissue of some hormones that reach it from the brain. And then it also lets out its own hormones. So endocrine drugs are used to treat deficiencies or excesses of specific hormones, or it can be non-endocrine diseases too. So select drugs for thyroid conditions. Thyroid, where's the thyroid, Jonah? Yeah. Okay, flip here, kind of wrapped around your trachea. So diseases of the thyroid gland, hypothyroidism, which would be what? Low thyroid hormone, basically. Or there's different aspects of it, but hyperthyroidism, which would be excessive, and then overproduction of the thyroid hormone itself. Okay, let's just go back and forth because thyroid hormones is in here on page, let's go to your big packets on page 50. Yeah, on your big the packet from the Irish book. We'll go ahead and so we're not going having to repeat stuff. Okay, so at the bottom, page 50, it says thyroid hormones. It says hypothyroidism, iodine deficiency disease in children results in cretinism. And we looked at that, I think, or we will. The symptom in adults includes apathy, decreased heart rate, and depression. Symptoms in children include short stature, thick tongue, possible enlarged thyroid, lower voice pitch, myxedema, puffy face, reduced mental acuity, and weight gain. So iodine deficiency itself is a big ordeal. That's why if you ever notice on our salt it says it's like it's iodized. Okay, that's one of the things. Now, iodine deficiency, your thyroid needs iodine to work, and that's why it's related to that. So whenever you hear that word iodine, think thyroid. If you see that word, in one of the tests, it's related to the thyroid. Okay, so indications for thyroid hormones. So it says thyroid replacement therapy, adverse reactions, or cardiotoxicity in hyperthyroidism. So you can make too much at that point. Patient should undergo thyroid stimulating hormone test. It's called TSH. Okay, it's a hormone that stimulates the thyroid to do what it's supposed to do. And so if it's not working, then the thyroid's not going to get its message in what it's supposed to do. So people who are taking these medicines will have their TSH checked pretty regular. So on here, probably most commonly prescribed one is this levothyroxine that I starred on there. It's called Synthroid. It's not real hard to pick it out, but it's a thyroid hormone, levothyroxine and Synthroid. So usually tablets, I would say, can be injected if it needs to, but a lot of people take this. Okay, a lot of people have hypothyroidism. Okay, hyperthyroidism or Graves' disease is an excessive secretion of thyroid hormones. It may be caused by thyroid nodules, so they may have some kind of like a tumor that may be secreting this, excessive iodine intake, or a tumor causing overproduction of this thyroid stimulating hormone. So symptoms include decreased menses, means that women are not having their normal menstrual period, diarrhea, exophthalmos. Exophthalmos is where their eyes kind of look They look kind of bug-eyed. It's like their eyes kind of stick out a little bit out of their head. Heat intolerance, so they cannot stand to be hot. Okay, or they're going to have like hot flashes kind of thing. Nervousness, perspiration, tachycardia, which is what? Yes, and then possible weight loss. It's like an increase in metabolism almost, but not in a good way. Whereas hypothyroidism a lot of times is like low metabolism. You feel kind of groggy, slow, tired, weight gain. Hyperthyroidism is kind of opposite. So therapy includes hormone replacement or surgery. Adverse reactions of these: fever, sore throat, unusual bleeding or bruising, headache. Malaise is just like fatigue. And it might be an effect of that. PTU is the one I've probably seen the most on here. Radioactive iodine is they've had a specific type of tumor that causes that. Not necessarily a tumor, but they can actually give it the, I don't know. Anyways, it's pretty interesting how it works. I don't want to go into it because I'll probably explain it wrong, but not things that are really commonly prescribed. Hyperthyroidism is not nearly as common as hypothyroidism is. Okay, let's go back to this PowerPoint. We'll kind of skip around. Okay, so drugs for diabetes. We know diabetes is what? You have too much what? Blood sugar. Okay, it doesn't necessarily mean that you're taking too much sugar. You can, but usually it's just that your insulin either is not working or you're not producing enough. Okay, but there's two classifications of diabetes. Type 1, which is insulin-dependent diabetes. These are people who actually use like insulin, has to be treated with that. Okay, juvenile diabetes, like when people are diagnosed with it when they're young, it's type 1. Okay, type 2 diabetes, this is non-insulin dependent diabetes. You'll see it sometimes, NIDDM, you'll see it abbreviated that way. May require insulin, but it may not. They can take oral hypoglycemics. So medications like we've talked about, glipizide, I think that was on there a couple weeks ago, or metformin. Okay, those are oral hypoglycemics. Those are for type 2. Excuse me. Okay, so types of insulin. We talked about this a little bit, I think about a few weeks ago. We have rapid-acting insulin, so Lispro is one example of that. Short-acting, regular insulin is kind of like your standard. You give it according to what their blood sugar is at that moment. And regular can be mixed with other ones. Okay, the rest of these can't. NPH, or intermediate acting, is NPH and lintate. So like you can mix regular and NPH together to give them something that will work now and later. And then long acting, ultra lintate and this glargine. I'm not sure if I'm saying that right, but there was another one we talked about the other day. I don't know. There's lots of long acting. Lispro is not Lispro, obviously that's a really rapid one. What is one? Levemir is one that I think is a really long-acting one. Okay, examples of oral hypoglycemic drugs. So that means they can take it by mouth. They just take a pill for it, okay, and it should last over that 24 hours. Now, obviously, with oral hypoglycemics, you're not going to have the same, like, exact effect that you would with, like, regular insulin. You give it for a certain, you know, this is going to be over 24 hours, so you're just trying to keep it in a good range. Okay, glipizide, glucotrol. Do we have that one yet on our med list?
No, I don't think so. And glucophage.
Okay, glucophage, that's the metformin. Glucotrol or glipizide is one example of that. These I haven't seen as much, but we've talked about metformin and glucophage. Actose and Amandia, those, I've seen both of those before. The other one, I can't say that I've seen that one. Let's look. Over here, where are we? Here we are. Go skip on in this other packet. Oops. to page 53 in this Mosby's review packet. Hypoglycemic agents. Okay, so again with the type 1 and type 2. Sometimes type 2 a lot of times is related to diet and weight are two things that type 2 diabetes has an effect on. And that could be that either their insulin's not working anymore or that they're just not making enough. Gestational diabetes, this one added a couple. Gestational diabetes is specifically during pregnancy, and all pregnant women who have prenatal care get tested for gestational diabetes, but it usually goes away. So, but I think they say that it does mean that you have an increased risk of type 2 diabetes later. Secondary diabetes, it can be caused by other meds, like you take another medication and it causes the diabetes. Let's see. We talked about those three. Well, let's look at the adverse reactions. The enzyme inhibitors, abdominal pain, diarrhea, flatulence, or flatulence is gas. Wouldn't want to take it if you had cirrhosis, bowel disease. It's going to work. See how it says that it works and it inhibits the intestinal wall enzymes that cause glucose that cause saccharides into glucose, so it breaks them down into individual glucose molecules. So if it works on the intestine, so if you have any kind of intestinal issue, maybe you wouldn't want to take it. It makes sense. Thioguanides, I'm not sure if I'm saying that right either, but decrease intestinal absorption of glucose and improve insulin sensitivity. So again, with the intestinal, you want to be careful. Same idea there. Adverse reactions, nausea, metallic aftertaste, and weight loss. And then the glutazones, they make the cells respond better. It says they improve the response to glucose. So they increase plasma volume. It says elevate or adverse reaction, increased plasma volume, elevated high density lipoproteins. Look at hypoglycemic agents. Limipiride, that's the amyl, glipizide, glyburide. They're going to sound kind of like glucose. That can be a clue for you in there. Look at the different insulins that are listed on here on 54. So different ones. Levemir, again, is a long-acting. I think that one you take every 24 hours. Regular insulins, NPH is intermediate. Humulin is 70-30. Okay, see how it has the numbers on it? Okay, that tells you that it's a mixture of drugs. So it's got a mixture of like intermediate acting and regular. 70-30, that's the ratio. So 50-50, same idea. Humalog is one you might see. That's a rapid. Lantus, that's one I couldn't think of a while ago. Lantus is long acting. Okay. All right. Sorry. Back and forth. Back to the PowerPoint. So that's hypoglycemic drugs and insulins. Just know one you need to know, kind of have an idea. You don't have to know specifically. I don't think. You probably need to have an idea which ones are long-acting and which ones are intermediate and regular. I wouldn't say memorize the list, but especially the ones that I start on there, those are the ones that you'll see most often. Okay, oral contraceptive. So manipulation of estrogen and progesterone levels to prevent pregnancy. Oral contraceptives include estrogen and progestin combinations or progestin only. So look on here, go back a couple pages, go back to 51 in the, yeah. Go back to, okay, 51, let's see. Hormone replacement therapy at the bottom there. It says estrogen replacement therapy. Relieve symptoms of estrogen deficiency. So there's a few different things. You can estrogen as a contraceptive to prevent pregnancy, usually mixed with progestin, or estrogen replacement therapy is like after someone no longer has their hormones. So after menopause, might take estrogen to replace that. Or if they've had a hysterectomy, that's another reason they would have to replace that, because that is, it depends on, I guess, the level of hysterectomy that they get. But usually if someone has a hysterectomy, they'll also take this estrogen replacement therapy. Okay, relief symptoms of estrogen deficiency. The deficiency results in symptoms of vasomotor instability, drying and atrophy of vaginal mucosa, insomnia, irritability, and mood changes. So the way that it works, it says it suppresses follicle-stimulating hormone secretion, which blocks follicular development and ovulation. Adverse reactions: nausea, bloating, weight gain, breast tenderness, breakthrough bleeding. Because all estrogen products should be dispensed with a I'm really struggling today. Patient package insert. That is something you will be asked on the test. It's going to say which of the following has to have a PPI, a patient package insert, and it's always going to be hormone replacement, contraceptive, something like that. And they have to have an insert with them. That is one thing that you'll definitely want to know. Okay, examples of estrogens. This Premarin, I've seen that one pretty commonly, and Prempro, seen that one too. Those first two on there, and you'll see other ones too, but just know those two for sure. Okay, progestins. That's treatment of menstrual dysfunction such as uterine bleeding, amenorrhea, which is not having a menstrual cycle, dysmenorrhea, which would be painful, and endometriosis, which is the lining of the inside of the uterus, where there's like an abnormal, a lot of times they have lots of bleeding, cramping, really painful, but it's like this abnormal kind of buildup of the inside of the uterus. Okay, adverse reactions: weight gain, depression, fatigue, acne, hirsutism, which is like hair growth. So examples of these: norethindrone, levonorgestrel. So you'll see any of these. Micronor is probably pretty commonly prescribed on here, norethindrone. Now, these can actually be used as a contraceptive also. A lot of times people, when they are breastfeeding in particular, because estrogen can mess with milk supply, and so they take a progestin-only birth control to help prevent pregnancy too. Okay, look at oral contraceptives. Normally these are a combination of progestin and estrogen, so both. Look how it works. Suppresses ovulation by interfering with production of hormones that regulate the cycle and alter cervical mucus. So one of the ways that this works is it basically makes your body think you're already pregnant, and so that you won't ovulate. That's one of the ways that these work. They can. There's all kinds of different ways that they can work, but that's one of the main ways that combo drugs will work. Adverse reactions: potential for heart attack, stroke, and thromboembolic disease. So if somebody smokes, they're going to say you don't need to be taking birth control. That's a big no-no to do while you're on birth control is smoking, because the way that smoking increases the risk of blood clots, and so does this medication. Other side effects: nausea, weight gain, breast tenderness, and depression. Again, has to have a patient package insert. It'll be abbreviated PPI whenever you go to take it on the test. So lots and lots of examples of these on here. But most of the time, whenever you see these, if it says them in like the generic name form, it'll say that estradiol. I don't know if I'm saying something right. But just know estrogen, it's going to sound kind of similar to estrogen. Norethindrone or levonorgestrel, that's the progestin part of it. But you'll see a combo drug, and you can kind of assume that's probably what it is. It's a combo of estrogen and progesterone. Most of these are by tablet. One of these is an implant, so they actually implant it like into the arm. Usually stays for, let's say, like 3 to 5 years, maybe. Not exactly sure. It's either 3 or 5. I'm not really sure which one. And then there's some injections on here too. Let's go on in here. I kind of want to go through. Let's go on and do this bone disease agents, and then we'll talk about the steroids as well. So underneath here. Oh, I wanted to show you all this too. This on the right-hand side of this paper that talks about things that interact with oral contraceptives, and there's lots of those. Antibiotics, we've talked about that before. Antibiotics can make birth control where it doesn't work very well. Anticonvulsants, antifungals. So lots and lots of interactions there. Okay, look at this bone disease agents. This doesn't necessarily go with hormones, but we're going to put it in here anyways because we are. I'm afraid I'll skip it if I don't go over it today before I get to steroids. Fosamax and Fosamax with vitamin D. It's biphosphate approved for osteoporosis. So these are osteoporosis treatment. Inhibits bone reabsorption by osteoclasts. We know how that works. That is, should be taken 30 minutes before the first meal, beverage, or medication of the day, and it just needs to be taken with water. It will burn the esophagus, so they're not supposed to lay down for 30 minutes after they take it. And that's something that you'll probably see on here too. Fosamax is one that you may very well see. So you don't want them to lay down because of the way that it burns the esophagus. So a lot of people who have really bad reflux, this is not a good medicine for them. Micalcin is a nasal spray for estrogen replacement therapy. And the reason that this bone disease, this is all in here at the same time is because estrogen also works to prevent osteoporosis. It works with your calcium absorption and so forth. So when people lose, like when they go through menopause or if they have a hysterectomy, they're at increased risk for osteoporosis because of the fact that they can't absorb and keep their calcium like they normally would be able to. So that's another reason people take estrogen replacement therapy is so to prevent osteoporosis ultimately. Micalcin is one that is an intranasal one. Mevista is another one. Actonel is one that you see commonly that's listed. I started on there. So that's that. Okay, corticosteroids. So a few reasons that you'll see these, particularly to decrease inflammation. Like if somebody's going through an asthma attack or if they have some other kind of infection with inflammation, sometimes they'll take a steroid to kind of decrease inflammation. Or, you know, people take like steroid injections in their knee or their back if they have a really inflamed joint, those kind of things. Okay, but also for Addison's disease, it says it's a deficiency of glucocorticoids and mineralocorticoids. Those are all steroids that come from the adrenal gland. Symptoms include weakness, weight loss, hyperpigmentation of the skin, so their skin will be darker than normal, reduced blood pressure, low sodium, low glucose, and hyperkalemia, so high potassium. And then also for Cushing's, says this is a result from an overproduction of steroids or an excessive administration of steroids over an extended period. So usually you'll see, this is like what I was talking about a while ago with the moon face. Okay, so really round face. You may get what's called a buffalo hump, which is like a fatty tissue kind of, or like excess fatty tissue back here on their upper back. Protruding abdomen, so again, kind of just round, like round face, round belly. Used for inflammation, adverse reactions or stomach irritation, high blood pressure. They're going to hang on to their sodium. That's what's called part of what's causing the edema. Okay, they're going to hang on to fluid. Slow wound healing, because again, steroids depress the immune system. Thinning of the skin, peptic ulcer disease, increased infections, reduced white blood cell, again with the immunosuppression. Truncal obesity, so again with the larger belly, moon face, buffalo hump, hyperglycemia, high blood sugar, hypokalemia, the opposite of the other. So some of these you'll see cortisone. You've probably heard of cortisone injections before. A lot of times that's what they get. Somebody will get in like their knee. Dexamethasone or Decadron is another one. Prednisolone. That one's often given for like respiratory infections to decrease that inflammation. And then there's a whole list of side effects down there too. The rest of these are